Howdy everyone, my name is Elaine Webb, and my clinical practice project for this course is the reinvigoration of nursing confidence in a busy labor and delivery unit in using Novi cordless fetal monitors. Continuous fetal monitoring has actually become the standard of care in most hospitals in this country, especially if the patients have risk factors like obesity. Obesity limits patient position changes while in labor and pushing, as does just patients that are actively moving about in labor. Yet evidence has shown that it is important for a patient to be moving around and mobile and change positions whenever they need to in labor to keep it progressing. So nurses are stuck in that difficult position of knowing that the patient has to be on continuous monitoring, yet knowing they need to move around, and this can limit the amount of continuous fetal monitoring that can occur. And cordless fetal monitors that were introduced in 2012 are actually maybe a possible solution to that problem. The setting of this project is a busy labor and delivery unit at Houston Methodist Willowbrook Hospital that has between 300 and 350 deliveries a month. There is a diverse patient population cared for there that's a mixture of high-risk, high-acuity patients with low-risk patients, such as those that just come to the facility instead of going to birthing centers, yet have a birthing plan and want a lot of freedom of movement while they're in labor. There also was noticed an increase in the number of obese patients that are being cared for at the facility, meaning their BMI is greater than or equal to 30. One of the many problems in meeting with the recommendations or guidelines of care is for high-risk patients or those in advanced labor is the difficulty to continuously monitor babies while the pregnant patient is moving, or due to the obvious physical problems with obesity that can impede continuous fetal monitoring. This diverse patient population actually gave an opportunity for the facility to improve patient care and outcomes, provide innovative patient care, and at the same time improve patient satisfaction by purchasing and using cordless fetal monitors that are comparable to the gold standard of internal fetal monitors. So the Novi fetal monitors were purchased by the facility and implemented for use in March of 2017. In the 2 months that followed, initial staff enthusiasm for the use quickly became negative. Part of the problem was that the introduction of the monitors included only one staff in service with the product representative that actually didn't include all staff on the unit. There was also minimal introduction and explanation of the monitors to the physicians and staff. Troubleshooting and technical problems with the system also included having to send the pod portions back to the manufacturer for software updates that took over a month, and we lost many super users due to the sister hospital that opened very close to us. That is where this project provided the perfect opportunity to reinvigorate and re-engage nursing and physicians in using the Novi cordless fetal monitors. Re-educating the nurses in using these monitors hopefully will increase nurse confidence in placing, using, and troubleshooting the Novi, being able to continuously monitor obese patients and those moving in labor, increase patient mobility while they were in labor and pushing, to decrease the possibility of maternal fetal heart rate confusion, which can have disastrous outcomes, and lastly, increase patient satisfaction and improve patient outcomes. Prior to implementing the project, a rigorous literature search was conducted to supplement literature obtained for a magnet story in the spring that supported the efficacy and use of the Novi cordless fetal monitors. Hospital policies were also reviewed for guidelines of care regarding fetal monitoring of laboring patients, and professional practice guidelines of care were also studied to provide insight. As evidence has shown, one of the best ways to get nurses engaged in changing or improving nursing practice is to show how an intervention with evidence-based practice improves patient outcomes. And in discussing goals or outcomes for the project, the primary goal of the intervention was to increase nursing confidence and engagement in using and troubleshooting the Novi fetal monitors by using a multifaceted multimodal educational in-service. The secondary goal was that by increasing nursing confidence, it would increase monitor usage, which would then conversely increase patient satisfaction and improve patient outcomes. When discussing ethical consideration, conflict of interest was avoided by a clear separation of the roles of student versus employee. A mannequin was used for skills in troubleshooting practice versus actual patients. The survey process itself was anonymous and didn't have any identifying markers in the questionnaires. And lastly, patient confidentiality was preserved by not accessing records or patient information being disseminated. With regards to the pre-intervention and educational intervention aspects of the project, it was quickly determined that the education of staff was the appropriate intervention, and an in-service seemed like the logical tool to use. There was also a four-pronged approach to the educational in-service that needed to happen, which included a PowerPoint presentation, a poster board that was left on the unit for continued reference for troubleshooting tips, and patch placement. Another component of the in-service included a skill station with a mannequin provided by the facility. which was used to help nurses practice placing the monitor patches, discuss how to troubleshoot their placement, and address any concerns immediately as they occurred. The last component was allowing time at the end for the in-service for staff to ask questions, provide their insight, and ask for volunteers as super users to continue project momentum to hopefully increase nursing confidence and thus increase fetal monitor use. By the end of all the in-services, 4 staff nurses for each shift volunteered to be super users, and a physician champion was obtained. The biggest surprise that resulted from the in-service was that a nurse who was very negative towards the fetal monitors since they began using them actually volunteered to be a super user. She stated that she felt like she had her mind changed around after getting to be in the educational in-service. So that's one of the biggest lessons learned from this project implementation, that education and confidence make all the difference in staff engagement and willingness to go through a practice change. Part of the intervention used to determine barriers was using a pre-test, post-test survey. This evaluation tool was chosen because it fits the means to evaluate project effectiveness the best. These surveys also provided a method to gather needed information from the nurses that could be tailored and incorporated into the in-services to meet and address the barriers they felt impeded them from using the monitors. Pre-test surveys were given to staff during the week prior to the in-services. They were given to both day shift and night shift nurses, with 30 nurses responding. Many barriers were listed. Most of them focused on problems with troubleshooting, intermittent tracing, lack of confidence in placing and troubleshooting the monitors, and a lack of support for staff. So that was all incorporated into the in-services to try to address those barriers. Next came the actual in-services. So due to time constraints and the difficulty in providing an in-service to 2 separate shifts, multiple in-services occurred over 4 days around a weekend in an attempt to reach as much staff as possible. The number of staff receiving the in-service was not as many as expected due to a busy unit on Friday and Monday, coupled with low census on the weekend. So while 30 nurses were able to answer pre-test survey questions, only 20 nurses received the in-services and completed post-test surveys. Yet even with those results, they proved to be an invaluable tool to determine whether intervention actually changed nursing confidence and perceptions about using the monitors. In reviewing the data and looking at the data tables, the overall result of the in-services was that the nurses stated they felt more informed and better prepared to use and troubleshoot the monitors. By far the biggest complaint from staff stemmed from feeling frustration at not having enough help with troubleshooting and problems with intermittent monitor tracing. They also complained they did not receive enough information and education prior to starting the monitors. Overall, the responses both during the in-services and via the post-test results were positive. So after reviewing the pre-test, post-test answers, it can be concluded that the intervention was effective in addressing barriers and increasing nursing confidence in using and troubleshooting the monitors. This is evidenced by a significant increase in nursing satisfaction versus dissatisfaction with the monitors, with their confidence in using and troubleshooting the monitors, and a significant increase in nursing confidence of monitor effectiveness versus traditional monitors. There are legitimate concerns nurses, including the author, have about the cordless fetal monitors. Many were addressed and alleviated, such as increasing nursing confidence in placing and troubleshooting the monitors, finding more super users and a physician champion, and creating a poster board that will remain in the lounge as a reference at all times. But there still remain problems with intermittent signals, weak signals, and the monitors not always continuously tracing fetal heart tones regardless of the position the patient is in. Those are being reviewed and addressed by the product manufacturer. As for addressing future implications, one would be remiss not to mention the need for further research to determine if there is Bluetooth interference with the cordless fetal monitors that can cause signaling problems. There also is a paucity of newer and recent research on this cordless fetal monitors because the product is fairly new since just being introduced in 2012 with approval by the FDA. So more robust research needs to be conducted in this country to determine the product efficacy. For future projects, it is also vital to use an evaluation tool to measure project effectiveness. Adequate education using multiple modalities should also be done prior to implementation. It is extremely important to provide an adequate staff support during and after implementation to ensure continued engagement. Lastly, every effort should be made to make the process interprofessional and involve all stakeholders, especially the physicians. So noting the effectiveness of the in-services that increase nursing confidence and address barriers to using the monitors, a recommendation would also have to be to have monthly scheduled in-services to continue to monitor and address issues and barriers that arise. Thank you very much.